Welcome back. As more women look for low intervention births, there are more midwives at Women's Care ready to help. In tonight's Parenting and Pregnancy, sponsored by Women's Care, KEZI 9 News anchor Renee McCullough talks to one of the newest midwives on staff about what they offer patients.
I love everything about being a midwife. I love the ebb and flow of it. I love being with the patients.
Just like obstetricians, the 5 midwives at Women's Care deliver babies in a hospital setting.
Everything that we need for a delivery is in this room.
And Madison Knox says these state-of-the-art rooms at Riverbend have everything they need to offer women the most holistic experience possible.
Obviously, we've got our amazing bed that folds into a million different ways.
Not only do the beds move up and down so they can make patients more comfortable, the rooms are also big enough to move around in.
Maybe let's try getting on the birth ball in this position. This might help relieve, pressure on your back. Or if you're really just feeling crampy, maybe let's get in the bath and that will help you relax.
Knox says midwives try to offer a more hands-on experience for moms-to-be at the bedside as much as possible to see them through the different stages of labor.
Labor starts off slow and it ramps up and it gets really intense. And, that's kind of the general trajectory of it, but every woman is different.
And while they try to manage pain as naturally as possible, women can still choose to get an epidural or take fentanyl if they need to. Plus, since these midwives work alongside the obstetricians at Women's Care, they know they'll be ready to help in any high-risk situations.
So if one of our patients ends up needing a cesarean section, for example, to deliver, we have them as our backup.
And midwives are part of the process even after mom and baby go home. They can care for babies for up to 28 days, and they continue to check in on moms to see how breastfeeding is going, how they're bonding with their baby, and on their mental health. Knox says a lot of women suffer from postpartum depression, and they don't want anyone to feel ashamed to ask for help.
We want people to understand that it's a normal part of the process. It's nothing that she or they are doing wrong. It's part of their body coming back and healing from birth and something hormonally that's not balancing correctly. And there are ways to help. There are a lot of ways to help.
In Springfield, Renee McCullough, KEZI 9 News.